Hey y'all, how are you doing? So I'm putting this video together because next week I'm having a gender affirming surgery. Um, it's called FFS, or facial feminization surgery. And yeah, I'm really terrified and really excited about it. Terrified because it is, one, it's a surgery and it's going to change how I look, but it's also my face, which is, it's the first thing people see, of course. It's how you're presented to the world, all of that. And that's part of the same reason I'm excited about it, because it's something I wanted for almost 20 years, literally, since I first heard of FFS. And yeah, I have a lot of dysphoria about some things about my face. And yeah, so that's why I'm excited about it. I'm also a little bit excited for safety reasons. Like, so I'm non-binary, but and my goal isn't really to pass, but I would like to be able to. So to avoid harassment, stares, just people not welcoming me, able to use restrooms, gender restrooms, without stares or violence or that sort of thing. So yeah, I'm looking forward to it. I'm really excited, but yeah, I don't know exactly what the results are going to be like. I mean, nobody does it right after surgery. But yeah. So in this video, I'm going to talk through exactly what I'm getting done and kind of why. And yeah. Hopefully some people find this helpful, or who are curious about what I'm doing, or are looking at my specific surgeon, Dr. Mardirossian in Florida. I'll plan to do a follow-up video of this to talk through how it ended up. So, oof, my little cave cat is running around. So yeah, so I'll talk about what I'm getting done. So FFS is not like one procedure, like some other surgeries are, like really kind of one procedure. Like if you get top surgery, or that's really one procedure, and people know exactly what it is, basically. I mean, you could definitely have differences, but you know generally what's happening. Or bottom surgery, I mean, there are differences, but generally you know what's going on. With FFS, it's just something's going on with your face. You're doing something with your face, and it's a set of plastic surgeries. It could be anything from one plastic surgery to maybe 10 or more, which is fine. It just depends on what people want, how much money people have, where they have dysphoria, what their goals are, if it's to pass or versus relieving dysphoria, that kind of thing. And of course, where they start with and want to end up. So I'll talk about what I'm getting done now. So here's my face. And so I'm getting 4 things done. 2 of them, and these are my chopstick pointers. So getting 4 things done. 2 of them, and sorry, content warning, this is going to get kind of gruesome bodily stuff and may cause facial dysphoria. I mean, really may cause facial dysphoria if you have dysphoria around your face and you aren't looking to have that triggered. But anyway, so warning, starting now. So you 1 incision up here along my hairline, and then 1 incision here on the bottom of my nose. And the doctor I'm going with, Dr. Mardirossian, his scars look great on people. They look like they heal pretty quickly. Of course, it's hard to tell because a lot of images are posted by him or sent out by him, and then a lot of people who post before afters on their own, or just afters, they might be outliers, or they might be posting flattering pictures of themselves. So but yeah, I'm hopeful. So these surgeries are generally, except for one on the forehead, which is kind of rare for cis people, but the other ones are pretty common for cis people as well. So they're not uniquely trans surgeries. I guess the goal of gender affirming is definitely unique to trans people, but yeah. Anyway, so the 4 things I'm getting done is, first, I'm going to part my bangs for here. And so one is I'm getting a forehead, or I guess they call it forehead reduction or scalp advancement. So what this is I have a big forehead, or bigger than I'd like. I've been self-conscious about it my entire life. That's why I always have bangs, and why I wear a headband besides being cute. A headband keeps my bangs in place. And so what it does is, it is what it sounds like, and I was surprised that this could, when I first saw it, that this could actually be done. But, so, there are testosterone dominant hairlines and estrogen dominant hairlines through puberty again, and throughout adulthood too, but mostly through puberty. There is, so mine is kind of testosterone dominant. I mean, it is. One is this distance between my hairline and my, I guess, brow bone is kind of average for testosterone people. It looks big, but it's average if you compare it to like a cis man. And it has a shape that's kind of, pretty much straight across. A lot of them are like a U. Mine's a little bit of a U, I think, but not too much. And some estrogen dominant people have a U as well, and high foreheads, but generally they're lower and they're more rounded. So what I'm getting is hopefully a little bit down, about here, and for it to become rounded. So I'm gonna see exactly how it's gonna go. I mean, there's a limit to how much rounding can be done because of the skin, or but the hairline will end up something like this, like rounded like this. I think that might be a little too much, but somewhere around there. So that'll be great. I'm looking forward to that a lot, even if it can't be that rounded, because it's difficult, because there's a lot of space right here. So it'll be difficult to do full rounding, but we'll see. And along with that, in that incision as well, doing like forehead contouring. So what that is, so really I know someone who studied anthropology, archaeology, whatever, and told me about this, but this is really like the one thing that you subconsciously genders people's faces most often with, is the brow bone. So, so again, dysphoria, trigger warning, but testosterone dependent, dominant people have a brow bone that sticks out quite a bit more, all along the top, kind of like mini Neanderthal brow bones. Mine is not that big, but it's present, definitely. This right here, this bump, I call it my devil horns, or I also call it the mark of AMAB, because this is something that generally assigned male at birth people have, or it's really testosterone dominant people during puberty have, is this this horn. So don't use that to try to determine if someone's trans. I trust you people not to do that. So that will be rounded. I won't get into the details of how that's done, but I'm not rounded, I'm sorry, flattened. So estrogen dominant people generally have pretty flat, not completely flat all the time, but pretty flat brow bones. There might be a tiny bit of a bump there, but generally don't have something like this. So I'm looking forward to that. It's kind of one of those more subtle things that people won't notice, like, hey, what's up here with your brow bone? Did you get some brow bone work done? But it's something that like is more unconsciously noticed. And there's some funny things that people you don't notice, like there's makeup, but like it kind of casts a shadow down below when you have a Neanderthal brow bone. Um, so that'll change. I'm interested to see how it'll change how my eyes look. Probably not that much, but we'll see. And it'll have a couple other things that go along with this forehead work. One is like these lines. I don't like these lines. So I consider it to be a fine line between like cosmetic surgery and gender affirming surgery. I mean, these are plastic surgery procedures, which just means that changing things about your appearance, really. Um, so I'm not doing this to look better. A lot of people like really focus on really wanting to look better, according to society. Um, but there's so much that's gendered and has to do with how you look. Um, like these lines, I think I don't like them when I raise my eyebrows or fur or whatever. But they are gendered as well. It's estrogen dominant puberty people don't generally have those lines like that. So those should be gone because my skin will be stretched a lot, and my eyebrows will lift a little bit. I really don't want to look perma surprised, but they'll lift a little bit, um, like that maybe. I don't know, not very much. So that's my forehead. I'm going to hide this from you again. Hide my shame. Just kidding. It's not shameful. If you have a big forehead, it's not shameful. I'm just hilarious. So yeah. The other part, so that's 2 of the 4 procedures. The other 2, like I mentioned, are with this incision. So this is called like, what is it, a bullhorn incision, because it's like across the bottom of your nose and then kind of around a little bit. And I'm a Taurus, so that's perfect, even though I think that Western astrology is evil and colonial, but but I'm still a Taurus, so I'll have a Taurus scar there. A little bit, because most of the scar should go away, if not all of it. But so yeah, I'm getting 2 things down here. One is the one that I think will change my appearance the most is pretty subtle. It's a lip lift. So what that is I mean, really just lifting the upper lip by shortening this area, which is called the philtrum. Again, testosterone dominant people generally have a larger philtrum. I have a pretty big one. This is about 20 millimeters, and average for estrogen dominant people is somewhere like, I don't know, 10 to 13 or something like that. So, and I'm probably going to get about half removed, a little less than half probably. And it's difficult to, I'm playing around with my chopsticks, but it's difficult to simulate what that will look like. I think this is probably the best way to do it, but it's still not perfect. So it'll essentially, it'll shorten the philtrum, but it'll also lift, and I don't have much of an upper lip right now. It'll lift the upper lip and kind of curl it around. And it'll do it all the way over here because it's a bullhorn, but I can't really simulate that with my chopsticks, even though they're advanced YouTube devices. So this is without, hello, and then it looks something like this. And then, again, that's very approximate. Doesn't it look great? And then that's a couple other things too. Like, I'm looking forward to showing my beautiful top teeth when I talk. I really hate just showing my bottom teeth when I talk right now. Especially, I got my teeth aligned, but these just, I don't know. That's not gendered, that's just teeth. But what is gendered is showing my bottom teeth when I talk. That's a testosterone dominant thing. Not, again, these aren't 100% of the time or anything like that, but that's very common for testosterone dominant puberty people. So yeah, I'm looking forward to that. In some cases, people get it so done that they can't even close their mouth without like putting a lot of effort into it. So like that, my surgeon says that will not happen, and I don't want that to happen, of course. I want to be able to close my mouth. But yeah, I'm looking forward to that. But like I said, it's not like a huge change, and people might not even notice what it is, but I think it'll change my appearance the most. Before, after. I won't have that scowl. Again, this is just me. I'm not pulling up the ends of the bullhorn. All right, I'm silly. And the other thing with that incision is I'm getting getting my nose done. I never thought I would get a nose job, but yeah, it's a rhinoplasty. So the nose is kind of funny in that there's a lot of overlap in gendering between noses. This is definitely more of a testosterone dominant nose, but there are estrogen dominant people who have noses like this, especially as they get older. But still, it's bugged me my entire life, and I want a new one for it to be changed. So what's gonna happen here, and it really depends what, I still need a CT scan next week, which is, I don't know what the CT scan exactly is, but it looks inside. And then, then there's, once the surgeon gets in there, figure out exactly what can be done. I mean, they'll have an idea, but you never know exactly until you look inside, I guess. I don't know how surgery works. But, and I don't want to say exactly what it should be. I mean, just like when you're born, you can't decide exactly what it's going to look like. I don't mind if I don't know exactly what it's going to look like when I'm done, as long as it doesn't look too ridiculous, or botched or whatever. But so what's going to happen here is, one, this is kind of a hump, and this is kind of T dominant. What will happen is it'll be slightly concave instead of convex. So it'll be like, and this is extreme. It's not going to be this extreme, but like this kind of shape, like a ski slope shape, but it won't be that extreme. Like a lot of cis women, Instagram influencers and all that kind of thing get like a big ski slope. I'm definitely not getting that, but it'll be a small, like, I don't know. I can't do it well with chopstick while I'm looking at myself. But that's one. The tip will go up a little bit. It'll go up a little bit, like, I don't know, like that. So kind of more straight. And I think my nostrils, I'm going to get my nostrils reduced too, if I can still breathe with them. I'm going to talk to my surgeon a little bit more about that. But I have pretty big nostrils right now. So I don't want to be a pig nose. I really don't. That's one of the two things I really don't want. One is pig nose, especially with big nostrils. And the other one is too big of a ski slope that makes it look fake. Or not fake, but done. And I like this is kind of bulbous. That's a little more difficult to reduce, but I'm gonna see what he can do on that, and then get his input on what is gendered about the nose. So yeah, another thing I'm really excited about in my nose, and I need the CT scan to confirm if this can be done or what's going on in there, but I have a little bit of trouble breathing sometimes. Like, I breathe through my mouth a lot. Like, I've been breathing through my mouth during this video. I don't know if do people do that when they're talking? I don't know. But I breathe through my mouth a lot because it's hard to breathe through my nose a lot. And so I thought, like, the only thing that you could do during a rhinoplasty nose job is fixing a deviated septum, which I thought was like, if this is crooked here. But one, it can be if it's crooked in the way back. I don't think that's what that is. It might be. We'll see. And then there's a thing called enlarged turbinates, which are these, it's just part of the inside of the nose that can kind of be enlarged and block the, I don't know, nasal passages, whatever they are. So yeah, hopefully he does find that that's blocking it and he can do something about it, because I would love to be able to breathe better. Also, like, I kind of have a nasal voice. I don't know if it doesn't sound like, I don't know if you can tell, but I have a pretty nasal voice. I did a couple voice lessons, and my voice teacher said it sounded like I had a deviated septum. So I don't know. We'll see. Like I said, I really hope something can be done. I hope I can breathe better. So yeah, I'm getting those 4 things done. I I'm really looking forward to it. It's not going to change my face a lot. It's going to be millimeters are going to change. Um, this, like I said, I think this will be the most noticeable one. It won't look like that. But I just I can't stop playing with my chopsticks. No, it won't look like that either. So yeah, so there's other things that other people get done during FFS, and some of the more common ones are like chin work, which is I think the most intense thing people generally get done. Reshaping the chin. My chin is fine. I like my chin. Um, and like tracheal shave, people have Adam's apples. I don't have one really, so I'm happy about that. What else? Like cheek stuff, like cheek either implants or fat transfer of the cheeks. Mine are a little sunken, but they're fine. I don't know. I think they're fine. And sometimes people get eye work done. I don't know if that's as much of a gender thing, like I call it blepharoplasty. I don't know, and it just kind of removes lumpiness, like the hooded eyes up here, or bags protruding down here. I don't know. I have hooded eyes, but whatever. I'm Korean, half Korean, and yeah. So, and some people get real brow lifts where the eyebrows go higher. And then people get like lip injections and stuff like that to make them bigger. I don't know. I'm not looking for like a super femme or super, I don't know, attractive or whatever face. I just want it to be less dysphoric and maybe more passable. I don't like wanting to be passable. I don't like that as a goal because not that I think it's bad. I think it's good, especially for people who want that. But I don't know. I don't have a binary view of gender, and I would like to not pass as a cisgender, but it's just like so unsafe out there, and it's so unwelcoming out there for trans people sometimes. So I would like, when I want to be able to avoid that hatred and danger and all of that. So yeah, that's what I'm doing with my face. So I hope you all enjoyed hearing about my face. So I'm flying out on Sunday. That's 1, 2, 3 days from now, early in the morning, to get my COVID test. I need to get my COVID test locally in Florida, which I expect to pass. I just got a COVID test done here. I got results yesterday, and I was negative, thankfully. I'm scared of the airplane ride in airports because, of course, there's a lot of people there, and so I'm going to be as careful as I can. I got disinfectant wipes and like a KN95 mask, which is pretty good. I might double up the mask. I don't know if that works, but I may try that. And then I got hand sanitizer, of course. So, yeah, I think it'll be safe. We'll see. And then in Florida's kind of weird compared to Washington, or Seattle at least. Seattle, pretty much everyone here, at least in this neighborhood, wears masks. Some dudes don't while they're walking around. And we have a pretty low rate compared to a lot of the country and some of the world. But Florida, all I hear is that a lot of places nobody wears masks at all. And a lot of people don't think COVID exists. And apparently the COVID rate, I'm going to Palm Beach County, and the COVID rate there is like 3.5 times what it is in Seattle. In Miami, it's over 5 times right now. So it's better than that at least. So my plan is to go to the grocery store once, and then that's all. Hopefully to get groceries for the entire time I'm there. So yeah, it's going to be an intense recovery. My face is going to be a nightmare for a good week. A week after I get stuff removed and dressing removed off my face. Ranch dressing is removed off my face. Just no, that's not right. No, it's not real. It's like medical dressing. And yeah, that's it. I know this is a long video, but this is as much as for me as it is for you. Just kidding, it's more for me than it is for you. And the thing I'm going to miss the most is my cave cat down here. I love my cave cat. I live in a studio alone, so I'm going to miss Cave Cat so much, and Cave Cat's going to miss me, I think. Oh, Cave Cat's wheezing. So, yeah. Thanks for making it this far. I'm surprised you made it, but that's cool. So yeah, I'd appreciate any feedback. I don't know. I was gonna say leave a YouTube comment, but I'm scared of YouTube comments. This is my first video. So, yeah. I will try to do a follow-up after I'm done. And we'll see how it goes. You guys are awesome. You all are awesome. I shouldn't say you guys are awesome. You all are awesome. And TTFN. Bye.